Hello friends, I'm Dr. Swanand Gholap. I'm an ENT surgeon and I represent Urja Medical and Research Foundation. Today, our topic of discussion is the snoring and sleep apnea. Snoring is a noisy breathing during sleep. It is a distressing symptom not only to the performer but also to the people in his room. The cause of snoring is partial airway obstruction during respiration, which causes vibration of soft tissues in mouth. It is more common in fat persons, in drinkers, and in males over the age of 40 years. Most snorers actually do not know that they snore. Some snorers even develop obstructive sleep apnea. Obstructive sleep apnea is a common disorder where the throat muscles relax excessively during sleep. This causes airway to repeatedly narrow or completely close. This prevents air from getting into the lungs, and thus there is a sudden drop in blood oxygen level, and this triggers the survival reflex in brain that briefly wakes you up to resume the breathing. Now, coming to the symptoms of obstructive sleep apnea. The symptoms we get in OSA are, especially at night time, there is a loud chronic snoring, gasping or choking sounds, followed by pause in the breathing. In morning, person wakes with a dry mouth, sometimes with sore throat or dull headache. And during daytime, person gets excessive drowsiness, fatigue, brain fog, and irritability in routine work. Sexual dysfunction, irritable bowel syndrome, depression, memory loss, and sometimes claustrophobia is also observed. Well, now one more thing that we can observe, the snoring and sleep apnea in children also. Children with sleep apnea tend to be underweight and short stature. One can notice behavioral abnormalities like aggression, poor school performance, restlessness, hyperactivity, irritability, and lack of attention in children. In children, mostly the cause is obstruction due to big tonsils and adenoids, and it is not related with the muscles relaxation during deep sleep. Now, if you and your loved ones are experiencing such type of symptoms, then I can say further evaluation of oral and nasal passage is needed, and also the assessment of breathing during sleep is very helpful. Now, the sleep study will diagnose whether you have obstructive sleep apnea or simple snoring, and according to that, your doctor can plan the mode of action. Now, what is this sleep study? In this, patient spends the night in a private room at a local sleep lab or local sleep center, and here the patient's breathing pattern, oxygen concentration in blood, heart activity are monitored and recording during sleep. The overnight recording is safe and painless procedure. Nowadays, there are different gadgets, smartphones, or you can say smartwatches in the market which can monitor your sleep patterns, but I personally feel that proper sleep study in a sleep lab is more accurate. Some more investigations like sleep endoscopy or sleep MRI are again, you can say, new tools to diagnose the condition more accurately. Friends, please remember that obstructive sleep apnea is a silent killer. Yes, it is a silent killer. Obstructive sleep apnea is associated with increased risk of hypertension, heart failure, stroke, diabetes, and irregular heart rhythm. And thus, we can say that untreated obstructive sleep apnea will cause you more expenditure on health related issues. So it is important to diagnose, or you can say identify, or you can say again catch this condition very early and treat successfully. Well, now we'll come to some treatment part and sort of preventive measures for this condition. Well, in some patients, surgery on nose as well as throat are beneficial to reduce snoring. CPAP machines and some oral or dental appliances are also useful. So what is this CPAP? It's a continuous positive airway pressure, and it is like a small ventilator. You can say it's like a small radio, and it comes with a mask which fits on the nose of the patient properly, and it has to be used at night time. CPAP is, you can say, like a pneumatic splint which prevents upper airway from collapsing during sleep. Second important point is in overweight or obese patients, weight loss or weight reduction is the most important treatment part. I know it's a big challenge, but it helps. Now, we'll discuss some easy ways to stop snoring. They are: first one, to establish regular sleeping patterns to avoid exertion. Next, sleep on your side rather than your back, as sleep on the side causes less dropping open of the lower jaw and does less snoring. Third one is tilt the head of your bed and by 4 inches, as this allows easier flow of air through nose and throat. And one more thing is add some humidity to your bedroom, as we know that dry throat tend to vibrate more than one that is moist. So it is helpful, and you can use a humidifier in your room. There are some anti-snoring exercises of the muscles of the oral cavity, or you can say some yoga exercises which are helpful as they improve the tone of your throat muscles during deep sleep and prevent them from collapsing. In yoga exercises, I know some names like Siha Mudra. Yes, it is definitely helpful, and most important is to keep a healthy lifestyle, which means regular exercise, no tobacco, no alcohol. In conclusion, we can say that sound sleep is our need, and it will definitely give us good health. Thanks, friends, for listening, and please kindly accept my best regards. Thank you very much once again. Thanks.